Good morning. I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute here in Florida. I have with me a special patient who traveled from Indiana to Ocala, now living in Ocala, and he's here today less than 24 hours after having his Deuk laser disc repair done to fix his lower back and his left leg. And I remember you hobbled in here. You couldn't even walk. You were holding your leg like this, pulling your knee to your chest the whole time I talked to you. And here you are less than 24 hours after your surgery. How do you feel?
I feel amazing. I think I saw another person who had worked on, he said, I don't have the words, so I'm just like that. I can't, I'm still processing how good I feel. It's amazing.
I'm happy about that. And are you feeling good because we put you on powerful narcotic painkillers?
No, actually, today I took a muscle relaxer just in case, but had been taking painkillers like every 4 hours, day and night for the last month because I couldn't sleep. And it still didn't help me to sleep, but it just took the edge off a little bit. But it's just been hell for the last month.
And did you need the painkillers last night or today?
I took some last night, but not today.
Not today?
Not today.
And are you having that pain that you had before you came here?
No.
It's gone?
No, it's gone.
See, smile. Right?
I'm learning how to laugh again. I haven't done that in a while.
Learning how to laugh again, that is special. And you triggered something in me yesterday that I had not felt or thought about since my father and I had a conversation when I was just a little boy. I was probably 7 years old. And I asked my father, why do you love being an OB-GYN? Why do you love being a doctor so much? And he said, because being an OB-GYN, you're with patients at the happiest time of their life. And I realized after talking to you in recovery, and you were crying because you were feeling so good, that actually this may be also the happiest time in people's lives, right?
Yes.
When they're having a baby, and maybe when they're getting rid of that pain they've had for 20 years. So I thought, for the first time in my life, maybe I didn't stray so far from my father's footsteps.
That's true.
Yeah, we were talking about how he delivered babies and I deliver herniations.
And you said that's my purpose and that's why I come to work every day.
Oh, absolutely.
And
sure.
that's so amazing because in my life I haven't had that luxury. I worked with my back, which was really stupid. I found out I had scoliosis when I was about 15, and they said, don't do physical labor or whatever you do. But I worked in a warehouse, and I did a lot of lifting and things. It wasn't that kind of world where you go to work and feel like you're doing your purpose.
Yeah.
I did do ministry for 10 years while I was working, and I felt that.
Good.
I was happy.
You were touching people's lives in a positive way. So how long did you have your back pain before you came to see me yesterday?
Oh, we were talking about that. I had enough pain that when I was probably 25, so we're going back over 40 years, I saw a spine surgeon and they were trying to do an injection in my back, and they said there's a bone spur there and we have to go through it because we don't know how to do anything else.
It's an epidural.
And they liked it. I felt like they were killing me, and they finally had to stop the procedure. But this doctor told me, you have very small openings in all your back.
Correct.
And he said, I would not touch you with a 10-foot pole, and you should not let anybody else either.
So for 40 years you've had back pain. The doctors tried to fix it with shots. It didn't work. Do you still have that back pain you had for 40 years?
No.
This morning?
No. I had surgery 17 years ago because a guy came up with, he said he took a class and did the microscopic. That's all he was doing after he learned it. Thought, well, maybe, after that surgery I had the same pain, and I picked up a new pain in my S1, in my tailbone area.
So you got worse?
So I got worse. I had double pain for the last 17 years.
Double pain because of a bad surgery.
And so I said, I'm going to wait until I find somebody. And who knew you were here? If I'd have known, I'd have come to you.
Of course. Yeah, I was starting the laser surgery 17 years ago, so you probably would not have heard about it. But we're trying to get the word out, and I appreciate you sharing your story. You can see in your surgery here that we did your surgery through a small incision. We actually had to make a couple, but even then, we were able to successfully get the pressure off the nerves, clean out the tear with the laser, and the surgery went perfect. I think you're going to have a great result. Is there anything you want to share with the audience?
When you go to see the doctor and they're noted as the best, or you go to the best hospital, I've been to some of those. I even had the premier hospital in Indianapolis that was doing fine surgeries, and I went in and the doctor just said, well, we're going to do this. So I went to my osteopath and talked to him, and he said, that's just an old style surgery. They're going to do about a 12-inch incision on you, go in there and cut things up. And I didn't know that. I had to go to somebody I trusted to find that out. But these people were touted as the best. And I just would say to you, if you go get a second opinion, go to somebody that thinks different. Otherwise, you're just going to get a second opinion on the same thing. And so Dr. Deuk thinks different because he's created things that nobody else is doing. And if somebody throws that laser word out there, it means nothing. He knows how to use a laser. And it's not a laser as a laser. It's very different. I'm still, like I said, I'm learning how to laugh again. It
Praise
feels
God.
very
Go laugh with your granddaughter,
Very good.
who's been praying for you for 15 years now.
yeah.
Go
It's been
spend
more
some time.
closer to 20.
All right. Well, you go tell her how great you feel, okay?
Yeah,
Go tell it on the mountain.
I will. I'd love to work with Henry because he gets to see all this stuff and hear all your wisdom. So if you ever need somebody to help out,
We could always use
let
the
me
help.
know.
Henry could always use the help. We're ready for you anytime you want.
Okay.
Well, go enjoy life, okay?
Okay, thank you.
All right.
Thank you, Dr.
You're
Deuk.
welcome. It's my pleasure.